Hi, I'm Genevieve Gorder. I'm a mom, daughter, wife, music nerd, wannabe chef. The list goes on and on, but you probably know me best from my work as an interior designer. For as long as I can remember, health and healing have been part of my family fabric. I understand what it's like to live with a chronic illness, and I always say, if you hurt, design a landscape that helps you heal. That's why I wanted to take part in HSH TV created by Apellis. Together, we'll help support your treatment experience and create a landscape that works best for you. HSH TV will cover everything from storing your medication to organizing your supplies, all so that you can create a routine that's right for you.
What is EMPAVELI? Pegcetacoplan. EMPAVELI is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. What is the most important information I should know about EMPAVELI? EMPAVELI is a medicine that can affect your immune system and can lower the ability of your immune system to fight infections. EMPAVELI may increase your chance of getting serious and life-threatening meningococcal infections that may quickly become life-threatening and cause death if not recognized and treated early. EMPAVELI may also increase the risk of getting serious infections caused by certain bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. Serious infections may quickly become life-threatening and cause death if not recognized and treated early. You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines.
Today's episode is about storing your medication. We'll cover things like how to think about organizing your fridge with your health in mind, where to place your medication in your fridge, and of course, how to keep it away from any curious family members. Now let's get to work. EMPAVELI needs to be stored in the refrigerator between 36 and 46 degrees Fahrenheit. So when you get it from your specialty pharmacy, make sure to keep the vials of the medication in the original carton and then put it right in the fridge. Now, storing your medication in the fridge is not only necessary, but it's also a great way to inspire yourself to live in a healthy way. Approach your fridge like inspiration. Keep all of the colorful, healthy food at eye level and fill the middle with the more important produce and healthy choices. Doing this will help you gravitate to the healthy area first. When I have medication that I need to store in the fridge, I always keep it next to all of these clean, fresh foods. Keeping it near the produce helps make that area of the fridge feel beautifully magnetic. Keep it away from open packages, sauces, or meats. Another approach I recommend is to keep your medication in a clear acrylic container. It makes it so much easier to know where it is, and you'll be able to easily grab it when it's time to start prepping for your self-infusion. This is also a great first step to take to ease into a new routine. Now, you may have received a refrigerator storage container as part of the Home Sweet Home tools from Apellis. Personally, I think this is a great way to store your EMPAVELI vial cartons because it's designed to neatly hold them and keep them safe from the other items in your fridge, like those open packages. You can also lock the storage container in case you want an extra layer of security from any curious kids or partners. If you don't have a refrigeration storage container from Apellis, you can ask your Apellis care educator about receiving one, or you can find a different refrigerator safe container that works just like it. If you don't have a separate container or just don't have room for a separate container, you can also put the cartons in their own section of the fridge. Of course, the main thing to keep in mind with any type of storage is safety. So make sure your EMPAVELI is stored between 36 and 46 degrees Fahrenheit. Secure it from all tiny humans, furry friends, and yummy snacks. Remember, the refrigerator can be beautiful if you let it be. Organize it in a way that will help make you excited to open the door and look at all the things that help make you healthy. Your fruits, your veggies, and your medication.
EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. EMPAVELI can lower the ability of your immune system to fight infections. It may increase your chance of getting serious and life-threatening meningococcal infections. And serious infections caused by certain bacteria, such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These infections may quickly become life-threatening and cause death if not recognized and treated early. You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines. If your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. and you should also receive 2 weeks of antibiotics with your vaccinations. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI. Vaccines reduce the risk of serious infections, but do not prevent all serious infections. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever with or without shivers or the chills, fever and a rash, shortness of breath, extreme pain or discomfort, headache with nausea or vomiting, high heart rate, headache and a fever, headache with a stiff neck or stiff back, confusion, muscle aches with flu-like symptoms, clammy skin, eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. It is important to show this card to any healthcare provider to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI, have not been vaccinated against Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B, unless your healthcare provider decides that urgent treatment with EMPAVELI is needed, have a serious infection caused by the previously mentioned bacteria. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. If you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI. Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion. Stop your EMPAVELI infusion and tell your healthcare provider or get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, swelling of your face, tongue, or throat, feeling faint, or pass out. The most common side effects of EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash. These are not all of the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. Talk to your doctor for information on EMPAVELI. Please see important safety information, including boxed warning regarding risk of serious infections, and the full prescribing information and medication guide at empaveli.com.
Thanks for watching this video, and be sure to check out the other episodes we've created for HSH TV. I'll see you soon.